Okay, welcome and thank you for attending our annual public and members meetings for 2021. I'm Kevin Lockyer and I'm the Trust Chair. I want to start with a couple of minor housekeeping bits before we go any further. The first is the obvious one. This is the second time we've had to hold our annual public meeting virtually. And we really are missing the opportunity to meet face to face at our larger showcase event. I hope very much that we'll be able to return to something that better resembles our normal event next year. But if we've learned anything at all from the last 18 months, it's that not trying to look too far into the future. So we'll just have to see what the future holds on that. But in the meantime, today, I hope you'll get a flavour of just some of the great work that's been happening across the Trust. As with anything virtual like this, we've taken steps to ensure that we've reduced the chances of technical problems to a minimum. And one of the ways that we've done that is to pre-record our main presentations that you'll see and hear this morning. But despite the fact that they're pre-recorded, members of the board are available live to answer any questions you might have about the presentations or any other queries that you might have during the course of this meeting. There's a question function available for this event, so if you've got any questions, please submit them any point during the course of the meeting and we'll answer them at the appropriate points in the agenda. We're also recording this whole event and it will be shared on our website for those that aren't able to join us this morning. A couple of personal comments, if I may. This is my first public meeting as chair, and it's a pleasure to be able to host it, having only been in the role since the beginning of May. Now, as far as I'm concerned, it's a real privilege to be able to chair an NHS trust. Any NHS trust is a particular privilege for me to chair a trust in Lincolnshire, the county that's my home. And I hope during the course of my chairmanship that my contribution to the trust will be to help it to continue to improve our services and to put patients and service users at the heart of everything that we do and to build on the successes of the trust that you'll hear more about this morning. If I can achieve some of that over the next few years, then I will be glad. My first few months have been, as I guess you'd expect, busy, and I've had a fantastic welcome from all colleagues in the trust and from wider system partners in the county and from service users and carers that I've had the privilege of meeting over the last few months. Given that I am still relatively new, and that's an excuse I'll be making for as long as I can, and the period that we'll predominantly be talking about will be the last financial year, that is from April 2020 to the end of March this year, I'm going to leave a lot of the review of the year to Sarah Connery, our newly appointed Chief Executive. Now, I was really happy to be part of the process that appointed Sarah recently, and I'm personally really grateful to her for her work over the last few months as acting Chief Exec. Sarah, I'm really looking forward to continuing to work with you as we continue to improve our services and work with our health and care partners to deliver high quality, sustainable services for the future. And on a personal note, I wish you every possible success as Chief Executive of the Trust. So today is about taking the time to reflect on our performance and our achievements over the last year, and briefly to look at our priorities and ambitions for the future. Now, the last 18 months have been, by any definition of the word, extraordinary, and the COVID pandemic is written through everything pretty much that we've done over the last 18 months. But in that context, I think the Trust has done some absolutely extraordinary work, work that's helped to develop new ways of working, to implement new services, and alongside that, adapting our services to keep patients, carers and staff safe. It's been an extraordinary 18 months and an extraordinarily difficult 18 months, but I'm proud of what the Trust has been able to do and proud of the way in which we've been able to sustain services throughout that time. And we do indeed have a lot to be proud of and much to look forward to too, as investment in mental health and learning disability services continues as part of the NHS long-term plan. There are lots of things that we hopefully will be able to do over the coming period as a result of that commitment to investing in mental health and learning disability services. Today you'll hear from Sarah, our Chief Executive, but also our Director of Strategy, People and Partnerships, our Director of Nursing and our Director of Finance about the key areas of work we've been engaged in, not only to support our service users and carers, but also our staff. Also the work we've been doing with stakeholders to ensure the quality and safety of our services at what as I've said, has been an unprecedented period, as well as ensuring that we've got a sustainable financial basis for our services. The second part of our meeting, which is our members meeting, looks at our duties as a foundation trust and our accountability to you, our members. We'll hear from our lead governor, Giles Crust, about the work of our elected governors in representing members and the public's views, and our trust secretary about our current membership statistics. There'll also be an official announcement of the results of our latest governor elections. Now, I don't want to steal the thunder of the presenters that are going to follow me, so I'm not going to say a lot more on the board's performance and our plans. But before we move on to those presentations, I do want to take the opportunity to take Chair's prerogative and take a bit more time to thank some very important people in our trust. That is our volunteers. We like to use the opportunity of our annual public meeting to highlight the tremendous work of our volunteers because they give their time free to support our services, and also our governors who assist in the oversight and governance of our organisation and fulfil an absolutely crucial role. I'm pretty clear that we couldn't do what we do without that body of volunteers to support and help and guide us. And this year we've got 5 people who've received volunteer long service recognition, and I'd briefly like to take the time to name check them if that's okay. So for 6 years of volunteering, we have Rachel Burnett, Dawn Pearson and Steve Marshall. I'd like to thank all 3 of them. For 9 years, Suzanne Ridley, one of our previous staff governors. And for 12 years, Councillor Ron Oxby, who was one of our stakeholder governors representing the County Council. Just like to say thank you to all of you for everything that you've done and continue to do. I'm personally very grateful, and I know all of my colleagues on the board are too. Now we've got to do some routine official business before we get into the presentations, and we have to review the minutes of our last annual public meeting, at which I was obviously not present. Those minutes are on our trust website. If there are any comments on those, please feel free to contact our Deputy Trust Secretary Karen Scott to clarify them after the meeting. Can I ask then board colleagues in the meetings who were present last year to confirm that those minutes are an accurate reflection, please? Jane, I think you've got a comment.
Thank you, Chair. Jane Marshall, Director of Strategy, People and Partnerships. Under section 8 of the minutes, there was an action to follow up on a question from a member of the public, just to advise that that action was taken and a satisfactory outcome to the issue raised at the time was resolved in full. Just to make that point, Kevin, thank you very much. That's really helpful, Jane. Thank you for that. If there are no further comments or questions on those minutes, if colleagues are happy, I will sign them as an official record. With that formality done, I'd like to move on to the first part of our meeting, which is the annual public meeting, and hear from our Chief Executive and Executive Directors. Sarah, over to you, please.
Welcome to our APM. My name's Sarah Connery and I'm the Chief Executive of the Trust. I'm going to take a few minutes of your time to give an overview of 2020-2021 and also take some time to talk about our ambitions for the future as a trust. So first of all, personal reflections. It goes without saying that this year continued to be challenging and unprecedented. The COVID-19 pandemic meant we've had to change how we do things. What we achieved would not have been possible without our amazing dedicated team of staff and volunteers, our support from governors and members, our staff side representatives, our MPs, our local government, our health and care stakeholders, system partners, and our third sector partners. We really want to learn from the things that have gone well and ensure that we have the capacity to meet the demand of the future. So first of all, performance. At the Trust, we've continued to show very strong performance during the year. We have maintained our score of 1 for the NHS Oversight Framework. This looks at our use of resources and how much support our organisation needs from NHS England. Segment 1 is the best it can be and means that the Trust has needed very minimal support. Our patients continue to recommend our services and we receive lots of positive feedback. We're going to talk a little more on some of the specifics around our performance in some key areas a little later on, including out of area care, reducing hospital admissions, the National Staff Survey, but a few areas of focus for us now includes community waits and the community transformation work across Lincolnshire to reduce these, and ensuring our waiting lists across all services remain manageable with increasing demand, but with COVID restrictions still in place. Once again, we've shown an overall strong performance during the year against our national and local performance targets. I don't want to talk too much about our COVID response as our Director of Nursing will talk about this shortly, but we just want to highlight some of the general ways we've responded as the pandemic has continued. Teams have been absolutely fantastic in finding ways to continue to support our service users and carers at a very difficult time, and we are extremely grateful to our staff and volunteers for their flexibility and care during this time. Lincolnshire has planned for and dealt with surges in COVID cases as a strong system, supporting our colleagues in acute services where required. We've managed to find different ways of working to continue to support people using technology, including the helpline that came online just before lockdown began. We have extended our hours for our community teams to 7 days and to work with crisis services to prevent people reaching crisis point. We have continued to see those most at risk face-to-face where required. We've had to temporarily close our Manthorpe Older Adult Unit and Ashley House Rehab Unit to ensure that we could maintain safe inpatient services. But as a result of this, we've been able to implement a dementia home treatment team and bolstered the community rehabilitation, which has had a real positive impact on the number of people admitted to hospital. This has allowed us to meet our vision of supporting people to live well in their communities. Despite the ongoing pandemic, it has astounded me how much transformation and new services we've been able to bring on board. Mental health services are receiving significant investment as part of the commitments in the NHS long-term plan. Parity of esteem for mental health is so important, and in Lincolnshire we've managed to secure a wealth of new monies to expand and change our current service offer, with a focus on supporting people to live well in their communities. Firstly, our 2 new 24-hour, 7-day-a-week mental health helplines for adult and children, young people. These have been imperative during the pandemic when many people have needed someone to talk to or have been struggling with the impacts of lockdown. You can see both lines are receiving a good number of calls and have mechanisms in place to escalate and signpost people to appropriate support depending on their need. We've expanded our offer to schools as well, with a pilot of mental health support teams who have been supporting schools with pupils' well-being and developing a wealth of online resources for children, young people and their families. There are some great podcasts if you have a chance to take a listen, and these are all available on our website. We were pleased to have been nominated as the lead provider for the Midlands High Intensity Support Service for Veterans, part of the Up Courage mental health offer for all of our veterans, something really important in Lincolnshire with its links to the armed forces. We've also introduced new services focusing on early identification and support for those in touch with the criminal justice system and those who are homeless, wrapping care around this vulnerable group. I'll talk a little more in a second about how we've been altering our older people and adult acute pathways, but just to briefly mention, we've also been piloting new home treatment teams for mental health and dementia. We've also opened a brand new 15-bed female acute treatment ward in Sleaford at Ashvilla. This has massively supported our work to reduce out-of-area acute care. Some great news for the county. We've secured 37 million from the government to re-provide adult acute wards to eradicate dormitory ward accommodation. This means replacing our 3 current wards, Connolly and Charlesworth in Lincoln and Ward 12 in Boston. In Lincoln, we're building a 2-ward extension onto the existing Peter Hodgkinson Centre site, as seen in the picture. Good progress is being made in Lincoln, with planning permission approved and groundwork now coming to an end, ready for us to start building in the coming months and hopefully open in early 2023. In Boston, we'll be looking to move the ward to unused land we own at Norton Lee in the Boston area. Phase 1 will be to replace the acute ward and move support services such as crisis to the site and open a wellness cafe. However, we have ambitious plans to further expand the site in the future to be a community hub for both mental health and physical health, with a wide range of services using the site. We've already had some fantastic engagement with our experts by experience through the Building Together group, who are really helping to co-design these wards. One of our values is innovation, and I'd like to take some time now to talk about the transformation that has gone on in our services over the years. First of all, transforming care. This is a national agenda to support people with a learning disability and/or autism to avoid inappropriate hospital admission. This is about making adjustments to support access to other health and care services. At LPFT, with system partners, have made great strides in meeting this agenda throughout 2021. Children and young people. Following the closure of inpatient beds, we've continued to pilot an enhanced intensive home treatment service. This has significantly reduced the number of young people being admitted to mental health inpatient care by 71%, enabling families to feel more supported at home in their own communities. With a review of our clinical pathways in adult acute services, alongside the new female treatment ward at Ashvilla and a shift from rehab to reablement on the Wolds ward in Lincoln, we've been able to reach our target of 0 inappropriate out-of-area care for acute patients by April 2021. With the support of community rehab as well, this has also improved the flow of patients through our hospital inpatient services and reduced the amount of time people have to stay on a ward. We've already had great success with our pilot of home treatment team for older people with mental health problems, but with the temporary closure of the Manthorpe ward in Grantham during the pandemic, we've now been able to pilot a similar service for people with dementia. This has helped reduce hospital admission by 92% in mental health and has meant that nobody has had to travel out of Lincolnshire for hospital care during the pandemic. We absolutely value the input our experts by experience and peer support workers bring to our services. Our learning disability experts by experience were fantastic during the pandemic, helping to develop support and activity packs to tackle isolation and to shape the messages we were sharing with our service users. This slide summarises the community transformation work that has gone on in Lincolnshire since we were lucky enough to be selected to be one of 12 pilot sites. It's hard to do this work justice in one slide, but the key point I want to push is the true system partnership approach to this work. Working with the voluntary sector and primary care to increase capacity, particularly in lower wellbeing community options and crisis cafes, to address the obvious gaps in services, for example in personality disorder services, and to improve the connections between the parts for a seamless mental health pathway for our population. Our awards and accreditations. Our community teams, Steps to Change and crisis teams have continued their journeys to achieve the relevant Royal College of Psychiatrists accreditations. In community services, at the end of 2021, we had 7 of our 9 community teams accredited, with the final 2 teams working towards this national accreditation. We maintained our 2 stars for the Triangle of Care and did lots of work with our carers to develop local carer champions and a dedicated strategy. This also included gaining level 1 of the Carer Confident benchmark with Carers UK. The Trust was formally accredited as a Veterans Aware NHS Trust from the Veterans Covenant Healthcare Alliance. The Prevention and Management of Violence and Aggression team achieved the British Institute for Learning Disabilities Association of Certified Training mark by meeting all Restraint Reduction Network standards. Anita will speak more about our work on physical restraint later, and the team were also shortlisted for their work on PMVA training as part of the Nursing Times Workforce Awards. We achieved the Level 1 accreditation through the Future Focused Finance Towards Excellence programme, ensuring our finance practices support the delivery of quality care. And finally, Lindsay Kahn won the Mental Health Nurse of the Year at the British Journal of Nursing Awards. The Lincolnshire NHS system won Active Lincolnshire's Sport and Physical Activity Awards 2020. The Trust Staff Emotional Wellbeing Helpline, run by LPFT Staff Wellbeing Team, was part of this nomination and the support the team provide in the wider health and care system. Susanna Lancaster, a practitioner in Healthy Minds Lincolnshire, was shortlisted as a finalist for the Association for Psychological Therapies Awards for Excellence in September 2020. And even more fantastic, as recognition of the work all of our services do at LPFT, we were shortlisted as Mental Health Trust of the Year in 2020 and have been now again in 2021. We'll find out if we've been successful this year in November and are presenting to the panel of judges as we speak at this moment. Moving on from COVID-19, COVID restrictions do continue to apply across the country and in healthcare settings. We're able to safely deliver some face-to-face care, but we continue to adopt a hybrid approach with face-to-face and digital approaches being considered. We're evaluating the changes made during COVID to ensure that we learn from the positive changes made. We're evaluating feedback from staff, service users and carers, and we're using this feedback to set out our COVID-19 recovery roadmap, which is available on our website. Partnership working. Working as a system, we're moving to our integrated care system approach. We have a dedicated mental health, learning disability and autism partnership group, and the symbols there at the bottom of the slide show all of our key partners in moving forward with that agenda. We're putting in place a Lincolnshire strategic plan using population health data to ensure that we're focusing our resources on shifting the dial on patient outcomes and health inequalities. We're integrating our system at all levels. This is through neighbourhood teams, through primary care, hospital liaison, with the third sector councils and the police. In terms of our future ambitions as a trust, we want to be an outstanding provider of mental health, learning disabilities and autism services. We have an ambition to be an outstanding employer in the region. We want to continue to expand our community mental health support. We're keen to bridge the gap between primary and secondary mental health care for all ages, and hopefully some of the previous slides show how we're making real strides in this. And finally, we want to bring all acute mental health and psychiatric intensive care services into county. Thank you for listening to my reflections on the year and learning about our future ambitions. There will be an opportunity to ask questions at the end of the session, but for now I'd like to hand over to Jane Marshall.
Hello everyone, Jane Marshall, Director of Strategy, People and Partnerships, and a very big welcome to you this afternoon for supporting us at our annual public meeting. I'm going to talk a little bit about our wonderful people, our amazing staff, and some of our work over the last year together. Being told we're appreciated is one of the simplest and most uplifting things we can ever hear. And so the first thing I wanted to say was just how much we value and appreciate our people at LPFT. We are so very proud and thankful for everything our staff are doing and have done in the face of the pandemic. Throughout the last year, we've seen numerous examples of people going above and beyond, and not only playing a vital role in supporting people at risk or experiencing COVID, also continuing to work to improve services on top of that. Everyone has been affected at a personal level, and we all have lost loved ones and members of staff who we may have trained with or work with. So in terms of some of the things we are proud about that relate to our people, here we have some messages about the things that we've been able to achieve over the last year. There's lots here, I'm going to pick out a couple of them. We're in the top 10 mental health trusts in the English NHS for staff recommending us as a place to work, and that's really important to us as we go about our work, that staff feel valued and appreciated for the job that they do, but also that they will recommend us to others as a place to work. Because of the challenges we have on recruitment, we have quite a number of staff vacancies and posts that we're recruiting to. We are absolutely keen for people to consider coming to work at LPFT, and we hope that you'll take the opportunity to understand that we are a good employer. We aim to be a model employer, and we are starting all sorts of initiatives to try and not only retain the brilliant people we already have, but bring more people in to work with us. So on here you see that we have started international recruitment for our medical staff and our nursing staff, and we'll be making progress on that with a number of people planning to join us from overseas in the near future. In addition to that, we have worked really hard on introducing new roles and bringing apprentices into our organisation. We are in the top 10 NHS trusts in England for using Microsoft Teams, and we appreciate the fact that our staff have had to use that new software to work virtually, to be able to see patients and connect with each other. We're involved in a piece of research which is called the COVID Siren research, and you'll see from that infographic there we've got nearly 100 of our staff taking part in that research, and as an organisation we punch above our weight in terms of research and innovation, and innovation is one of our values. And lastly here I want to mention the COVID wellbeing risk assessments, where we were one of the first trusts in the country to introduce wellbeing assessments for our staff, where we asked people a series of questions with their permission about factors that related to their health and well-being and how we made reasonable adjustments for them whilst at work. We have 2,700 amazing staff who work at Lincolnshire Partnership, and we value and appreciate every one of those people and the work that they've done during the pandemic and continue to do. Part of what we do and offer to staff is our Staff Wellbeing Hub, and we expanded that offer to include a helpline for people to contact during the pandemic for additional support as they dealt with everything that was going on. And I'm really proud and pleased to thank the people who ran that helpline as part of our wellbeing offer for our people. The other thing we're proud of is the work of our staff networks over the last year, where we have supported those people who might identify with certain protected characteristics, such as colleagues who might identify with a heritage of Black, Asian or minority ethnic groups. We've supported those people who may have been more at risk because of COVID to come together in our staff networks, to support each other, to share information, and generally to come together to be supported in conversation with each other to help them stay safe and well at work. We've introduced a staff carers network because we were aware that some of our staff may have caring responsibilities at home as well as doing the jobs that they do at work, and we've changed our organisational policies to support staff carers in their work as a positive, reasonable adjustment for those people. In addition, we are very, very proud of the way staff have worked together to support each other in different ways. We've seen amazing examples of where people have been there for each other, creating safe spaces for decompression, small acts of kindness, and doing very simple things that have proved highly effective. So using some of the money that the wonderful Captain Sir Tom raised for us to create areas for staff to take a break with benches, pots of flowers and various things, just to give that safe space for our people to relax on their breaks and help them deal with what they were dealing with at work. This slide shows the fantastic feedback that we get from our staff as part of the NHS annual staff survey. It also shows the progress that we've made over the last number of years to improve the staff experience at our trust, and we're really proud of these results. So, for example, here, 82% of our people who filled in the survey say that they feel the care of service users and patients and carers is the organisation's top priority. That's a fantastic result. 82% of our people agree with that, and 75% would recommend us as a place to work. 71% as a place to receive treatment if it was their loved one, their family or their friend who needed it, and 81% of staff are often or always enthusiastic about their job. These are great results for us, and we're not complacent with these. We make sure that we are constantly engaging with our staff, asking them how it feels to work at LPFT and listening to their ideas about how we do even better. And there is work going on some areas where we know we still need to make improvements, and we're very pleased to make sure that we're constantly improving in this area. And finally, we would like to say a big thank you to all of our staff again for their contributions at work, but also to thank their families, their children, their loved ones for their contributions in kind and for supporting you as you do the jobs you do. We invest in recognising our heroes at LPFT, and we have a regular programme of awards that recognise the contribution of our people. In addition, we held an excellent virtual staff excellence awards this year to recognise people and all that they do every day in support of our patients, our service users, our carers, our volunteers and our stakeholders.
Thank you, Jane. I'd now like to introduce Anita Lewin, our Director of Nursing, Quality and Allied Health Professionals.
Good morning, everybody. I'm Anita Lewin. I am the Director of Nursing, Allied Health Professionals and Quality here at Lincolnshire Partnership Foundation Trust. I'm going to spend the next few minutes talking through some of the quality achievements we've had in the last 12 months. And I do have to say, you know, the organisation has worked incredibly hard in incredibly difficult times to keep quality at the heart of everything that they do. So here I am. I'm going to move on to a few of my slides and I will be happy to take any questions later. So just prior to lockdown last year, so prior to March 2020, we had an inspection from the Care Quality Commission of our rehabilitation services. The report for those services didn't come in until after you'd heard from me last year. So I'm just going to spend a couple of moments talking through the findings of that Care Quality Commission report and just talk through some of the improvements that we've made since. So as you can see, the inspections of the rehabilitation services, we maintained our good for safe, caring, responsive and well led. However, we did move to requires improvement for effective. The inspectors were really clear and spent some time with us talking about this. We know in terms of timing, we were in the very, very early stages of a full transformation of our rehabilitation services. And they acknowledged this. They acknowledged, you know, it was a very difficult time for them to come. However, we have taken that rating, we have considered it, and we have done lots of work with our staff and our patients about effective. And that is about the service that we deliver to our patients in our rehabilitation services. The inspectors were really clear. They would love to come back in a couple of years. They could see our plans. They could see where we were intending to go. And certainly I can say, as I present to you today, the rehabilitation services in the organisation have had an incredible 12 months. They are in a very different place. And when the Care Quality Commission come back to inspect those services, they will see a very different picture. So you heard earlier from the Chief Executive who has spoken about some of our response to the COVID-19 pandemic. But we know for us in mental health, it has been a steep learning curve. And I have to say, a learning curve that the staff, our patients, our carers, and everybody using our services have responded to. The staff have continued with the digital first approach. However, that does not mean that it is digital only. Where face-to-face care is needed, then that is what delivers. You heard earlier about our winter flu vaccination rates from last year. Absolutely incredible. The COVID-19 vaccination programme, again, the response from our workforce was absolutely phenomenal, and the majority of our workforce have had their COVID-19 vaccination. And here, as I present to you today, we are in the midst of our booster campaign. So we know that NHS staff are first in line for their boosters, and we are in the throe of that now, as well as giving our flu vaccinations. We have had a small amount of outbreaks on our inpatient wards and in our community services, but these have been very small. They have been managed incredibly well, and we have received several compliments on the way that we have managed COVID in our organisation. And I have to say, and I know you've all heard this, but hands, face, space really does remain the mantra, certainly of myself and the rest of the workforce. So just talking through some of the quality achievements, I said to you in my introduction, you know, it would have been easy to take the eye off the ball with some of these things as we worked tirelessly to manage COVID. However, the organisation and the staff were really clear that that was not what we were going to do. So the Prevention Management of Violence and Aggression training team have achieved their build certification. I cannot underestimate the hard work that goes into that. And whilst we haven't seen a reduction in the last 12 months on our physical restraint, we've seen our numbers maintained. And as the acuity and complexity of our patient increases, that is a major achievement. You can see there, friends and family tests, 90% of our patients still say that this is a place they would recommend to their friends and family. So that's something we're incredibly proud of. And as you can see on that last picture there, our patients continue to access safe and effective care that is COVID-19 safe. So in this slide, I'm giving you a sneak preview of really what is to come when you hear from me next year. In the last few months, we've had published our new quality strategy. And this diagram really is a summary of everything that is covered in that strategy. Service users, carers and our staff remain at the heart of everything that we do. We have taken the opportunity to boost our quality and patient safety teams. Our quality improvement agenda continues to grow despite the challenges. And it is important that we include service users and carers in everything that we do. The strategy was co-produced. It is a strategy I'm incredibly proud of. It's very simple, it's very basic, but it actually says very clearly the commitment from LPFT in terms of quality and patient safety. So I'm going to finish there. and thank you for listening to me. Goodbye.
Thank you, Anita. I'd now like to introduce Mark Platts, our Director of Finance and Information.
Good morning, everyone. So I'm Mark Platts. I'm the Acting Director of Finance and Information for the Trust, and I just wanted to take this opportunity to formally present to you all the annual accounts for Lincolnshire Partnership NHS Foundation Trust for 2020-21 financial year. So as part of my update, I'm going to give a quick summary of some of the key highlights, some of the financial headlines, and then we'll look at moving into 2021 and future developments from a financial viewpoint. In terms of a summary for the year, the Trust did manage to meet all of our expected financial targets for the year, and this was predominantly driven by the fact that every NHS organisation in the country operated under a national funding regime where we received cash to make sure that we could continue to deliver safe and effective services. However, despite this, I did want to make a point of noting that I'm extremely proud of the way that everyone in the organisation work together to make sure that we are operating in a cost-effective manner, making sure that we're making the best use of the funds that we had as an organisation. Another success for the financial year was the Trust was able to, despite the impacts of COVID-19, continue to invest in our capital and our estate, and we successfully opened the Asheville Award in Sleaford, enabling the organisation to reduce our out-of-area placements down to 0, meeting all regulated targets. That was a real positive for the organisation and the people of Lincolnshire. However, a point to note in terms of moving forward is we need to be really clear that we need to manage our recovery and restoration phase from COVID-19 really effectively to make sure that we continue to maintain to deliver value for money. In terms of our key financial headlines, I just want to highlight a couple of key elements of our annual accounts. Our operating surplus to the organisation for the year, we actually reported a just over a £400,000 deficit. Now, whilst this is a deficit position, this is predominantly driven by a revaluation of the Trust's asset base. So as part of our annual accounts, we conduct an annual review of our assets to make sure that we're reporting their value and their worth effectively. And unfortunately, quite a few of our key estate across the county have actually reduced in value. So this meant that we took a financial deficit through our accounts for this year. However, from a system reporting basis, as you can see there, as I mentioned, we have broken even. So that's driven by the national funding regime where all organisations receive national top-up funding to make sure that any impacts of COVID-19 were met from a financial basis. So from an operational viewpoint, the organisation has broken even, which is a real success for the year. Our non-current asset base, so this is the level of estates and buildings and assets that we hold as an organisation, that has increased over the financial year. Predominantly that's been driven by the work that we've been working on in Asheville, as I've mentioned earlier on, and we've also started to invest heavily within our dormitory ward accommodation that we're moving forward into 21-22 and that development there. So slight increase in our asset base. Capital expenditure, very similar to last year's levels, although looking at very different schemes. So we have invested just over £2.5 million in starting to eradicate our dormitory accommodation. A lot of that work was conducted over on our PHC site over in Lincoln at the Lincoln County Hospital site. That scheme's moving forward into the next couple of financial years and is part of our major refurbishment. We've also spent just over £1.5 million on our information and technology. So a lot of this was for new laptops, new sort of kit to enable remote working during the impacts of COVID-19. So a lot of our teams that were mainly office based are now working on laptops, which will enable us to be more agile working moving forward into the future. So a lot of investment across new areas from that viewpoint from last year. Our cash balance looks significantly higher to last year at £30 million. Predominantly, this is driven by the fact that we received £10 million to continue to develop our eradication dormitory schemes earlier than anticipated. So we received this cash in March, and we've therefore carried it over into this financial year to enable us to invest that as we move forward into 21-22. Moving forward into 21-22, there's three main areas of focus from a financial viewpoint that I think are important for the organisation. The first one is to continue to build on our success. So during the financial year 2021, the organisation has been working really closely with our commissioners, Lincolnshire Clinical Commissioning Group, to build relationships and really develop a deep understanding of all mental health expenditure across the county. Much of this investment is not actually held with the trust, so it's important that we can all work together to make sure that the Lincolnshire system delivers its mental health investment standards for the financial year moving forward. Also, it's important to make sure that we manage the post-COVID-19 demands on our services. This is about making sure that we've got the funds in place to continue to staff our wards effectively and make sure that we can meet all the future demands moving forward in a cost-effective and value-for-money way. In terms of the development of an integrated care system, there's a couple of key areas of focus for this one for us really. One is the continued development of community transformation services. From a financial viewpoint, this incorporates a lot of joint working, joint commissioning and joint tendering for services to make sure that we've got the best providers in place to provide services across the county. It's also important that we work with our system partners to make sure that we can continue to deliver a system-wide, stable financial position for the organisation. So this is about LPFT working with everyone across our healthcare system, those in acute and community, and also the commissioning groups, to make sure that we all manage our costs and delivery of services in a consistent and effective manner. Capital investment is also a key focus for 21-22. So I've touched on the investment of our eradication of dormitory schemes. In total, we've got just over £37 million investment in that. Much of that investment will actually be taking place during 21-22 and the following year. So it's important that we work with system partners to make sure that we can all afford our own capital investment whilst meeting the capital restrictions that we operate within. Collaboration is also really important. So it's really key that we all work as a system to jointly develop and improve our services across the county. So again, this will include working with voluntary sector organisations and other sectors across the county to make sure that we can provide a really broad range of services. Also, I'm really keen to use the next 12 months as an opportunity to continue and develop the use of digital solutions to improve patient experience. So there's a number of key projects coming along that we're working with system partners against, looking at shared care records and other key areas really. So it's really important that moving into 21-22 and the next financial years and beyond, we continue to develop the use of our digital across the system to make sure we can be as effective as possible.
Thank you, Mark. That concludes our presentations for today's meeting. I think though we've got some questions. Karen, can you read out the first question that we've received, please?
Yeah, I can, Kevin. So the first question is, our volunteers are part of our people. Are we able to include them back into their roles anytime soon, or do we aim to have them back to their roles?
Anita, I wonder if that's from a infection prevention and control perspective, whether or not that's something you might want to respond to first.
Yes, certainly, and I'll pick up the infection prevention control. And I'm also conscious that I've got my colleague Jane Marshall on the call, who is leading the volunteers. Now, in the world of infection prevention and control, obviously, kind of keeping everybody safe is the #1 priority for us. We are conscious that in people's general lives, the rules and regulations are lifting. However, for us in the NHS, we still do have lots of rules and regulations. We are monitoring those closely. We are monitoring them daily, it feels like at the moment. And I am aware that Jane and I are about to enter into conversations about potentially how we can kind of look at bringing volunteers back into some aspects of work. So yes, thank you for the question. I do appreciate it is a difficult position, but as I say, the priority is keeping everybody safe, but we are working through the rules that are heading our way, and hope to get volunteers back into our workplaces as soon as possible. They are indeed a valuable part of the workforce, so there is no doubt we need them in with us. So thank you for the question.
Thank you, Anita. Jane, do you want to add to that? No?
Anita did it perfectly. Nothing to add to that. Thank you.
Great stuff. Thank you very much, Jane. I hope that's a comprehensive and helpful answer to that question. Karen, I think we've got a second question.
We have from one of our governors, Rebecca Mezzo. She asks, do we recycle laptops that are no longer up to specification?
Mark, I wonder if you might be best placed to answer that question.
Yeah, certainly, Kevin. So this is something that we've been looking at as part of our waste reduction schemes and pulling it through. So we are looking at suppliers where we do enable us to do that. But at the minute, we do send them back to our IT provider, which is Arden and Gem, who are a support group that we work with, and they recycle as much as we can and do that on our behalf. So we don't directly do it as an organisation, but we work with them to maximise the recycling of our kit. Yeah. Thank you very much.
Thank you, Mark. I hope that's a helpful answer to that question. I don't think we've got any more questions for that section of the meeting. So I think now it's time to move on to the annual members part of this morning's session. And to kick that off, I'd just like to introduce our lead governor, Giles Crust.
Good morning, Giles Crust, lead governor and public governor for East Lindsey. And in April this year, I was privileged to be elected as lead governor of this trust. I was first elected as public governor for East Lindsey in 2012. I've been a governor for 8 years now. During this time, I have visited services within the trust and represented the public at various meetings and events. It is my privilege today to tell you about the work of the governors. The governors are all members of the trust and all volunteer their time. The service user, carer, public and staff governors are all elected from the membership of the trust. We also have some governors appointed by organisations who work most closely with the trust to deliver care for people with mental health and/or learning disability needs. These are known as stakeholder governors. We have two main duties. One is to represent the membership of the wider public, and the other is to hold the board of directors to account for the performance of the trust via our non-executive directors. I would hope my legacy as lead governor will be to persuade all governors to actively partake in all parts of governance, not just their particular speciality. You only get out of an organisation what you put in. To ensure we carry out the two duties I've just mentioned, governors regularly attend a Council of Governors meeting, where those duties form the most important part of the agenda. As well as doing this, the governors give their views to the trust to ensure that the needs of the public are included in the trust's strategic plans. We are given the opportunity to read and comment on the trust's annual report and accounts, so we can understand where the trust is going and challenge any areas of underperformance. Quality is an important part of what the trust does, and as governors, we agree the trust priorities and review the annual quality report. As a council, it is our responsibility to award the contract for external auditors. Governors were also involved in the selection process for a new trust chair, 2 non-executive directors, and it is the Council of Governors' responsibility to appoint these positions. This year as lead governor, I have taken an active part in the appointment of the new chief executive. A moment ago, I mentioned that one of the Council of Governors' responsibilities is to represent its members. Anyone can be a member of the trust, and joining is easy. People just need to complete a simple application form. For those of you who are members, thank you. And those who aren't, please sign up today by contacting Sam Swindell, who is our Governor and Membership Officer. It's easy to do, and details about how to do it can be found on the Trust's website, www.lpft.nhs.uk. On the 31st of March 2021, there were 9,704 members, and we continue to recruit new members. Please do ask your family and friends to join as members of the Trust. The Trust is responsible to you, but it needs to know your wishes and needs. The last 18 months have been unprecedented. The COVID-19 pandemic has meant that, unfortunately, we haven't been able to meet our members in the usual way. However, we have continued to engage with them in both written and electronic form. This year, we are engaging with the members by holding today's public meeting, albeit under very different circumstances. We have held all of our council meetings in public and published all of our meeting agendas, papers and minutes. Our meetings are recorded, which enables anyone to view them via the website. We do not hide anything. We are your trust and we need your trust. We produce a printed Better Together magazine twice a year, and between times produce an electronic version of the magazine. Both are always available on the website. As soon as it is deemed safe and practical to do so, governors will recommence a visit to services when they have an opportunity to meet service users in a variety of settings. Under normal circumstances, we would also engage with the members at public events and a range of groups and committees that are run by LPFT and other organisations. Plans are being drawn up for these events to restart. As governors, we want to hear about innovations and ideas that members of the Trust and the general public can give us to help us to contribute to the Trust's future plans and make services better in an approach of inclusion. Remember, we are here to service your needs. The feedback you give enables us as governors to influence key decisions, both within the Trust and in the wider health and social care organisations in Lincolnshire. Sometimes where issues relate to individuals, we direct concerns to the appropriate service and help produce immediate improvements. Without this knowledge from you, that is impossible. You have heard from the directors about the Trust's quality and financial performance. As a Council of Governors, we regularly receive reports through a variety of routes, and we hold the board to account through the non-executive directors who produce assurance report to every Governors meeting. Governors have the opportunity to directly contribute to the Trust's agreed quality targets and are particularly keen to review the Trust's progress against the Care Quality Commission outcomes. I would like to take this opportunity to thank you on behalf of myself and my fellow governors for joining us today and supporting the continued work of the Trust. I hope that this time next year we'll be able to meet in person again. I've enjoyed my time as Governor and lead and hope I have been beneficial to you all. I am now going to hand over to Peter Howie, Trust Secretary, who will provide you with the facts and figures around our membership and the requirements of the Constitution. Thank you.
Good morning, everybody. I'm Peter Howie, the Trust Secretary. These are some of the facts that we need to present to you within the annual members meeting each year. Okay, so we have to first talk about changes to the Constitution. And during 2020 and 21, no changes were made to the Constitution itself. However, during the year, there was a change to the Board of Directors standing orders, which was to reflect some changes in the committee structure. Also during the current year, the Task and Finish Group has been considering a number of proposed amendments to the Constitution. And these amendments were received from the governors, And then this task and finish group has reviewed those proposals, and subject to agreement from the Board of Directors, who are due to meet tomorrow, the Council of Governors has agreed that these proposals can be dealt with through the Governor and Membership Strategy and the work plans related to that, which will avoid the need for any further changes to the Constitution. Just to confirm, our membership constituencies have not changed within the year, and the membership constituencies remain as set out on the screen here. And within each of the 4 constituencies, there are different classes, which are also listed within the screen. There's been no change to this in this past year. Our membership numbers, again, we need to report on our membership numbers, and the year we're talking about is in the year 2021. You'll see in March 2020, the total membership was 9,766. And during that year, the membership has declined slightly to 9,704. There's always natural turnover within this, and during a period of time where COVID has restricted us from recruiting, that's only a slight loss in membership, which we plan to recover in future years. It's important that our membership is representative of the population. The information that we have demonstrates that women are overrepresented in our membership by approximately 25%. That is normal for membership organisations in this country. However, we will strive to increase the number of men within membership over the coming years. Other areas of the demographics show that our membership is broadly in line with the Lincolnshire population. Okay. So bear in mind we're now talking about a year ago in the elections held in 2021. At that time, the elections for staff governors were held, and the governors took up their seat on the 1st of October 2020. And in the previous year, by-elections were held for the 2 public governor seats for West Lindsey and Borough of Boston. Both of those were filled, but only for the 1 year remaining of the term. Now, in October, or starting from next month, in October this year, the elections for public governors have been held. And I'll read through the successful candidates for you in a few moments. They will take up their seats for 3 years from the 1st of October. In addition to that, by-elections for 2 service user seats and 1 older adult staff seats have been held. And again, these have been successfully filled, and I will read through for you the list of candidates that have been successful. Okay, the election results for this year's elections. These are in the public constituency. For the Boston class, the successful candidate is Marlene Fullwood. For the City of Lincoln class, Damien Taylor. For the East Lindsey class, Emma Slack. For the North Kesteven class, John Stacey. For the Rest of England class, Florence Mangenji. For the South Holland class, Brenda Wickham. For the South Kesteven class, Deborah Abrams, and for the West Lindsey class, David Doherty. Should be noted that within the public constituencies, a number of existing governors did stand for re-election and were unsuccessful. On behalf of the Trust, we would like to acknowledge their service and thank them. So those would be Thomas Ellis, Giles Crust, Linda Lowndes and Mark McKeown. In the by-elections, the 2 service user seats will be filled by Eve Ellaby and Linda Mellish, and the older adult staff seat will be filled by Debbie Judge. And that is the results from this year's elections. Okay, and does anyone have any questions?
I think the answer to that is no. Karen, I think you can just confirm that we don't have any questions.
I can, that's correct, Kevin, no questions.
Okay. In that case, then, it falls to me to offer some closing remarks and to bring this morning's session to a conclusion. I won't detain you for very long in doing that. First of all, I'd just like to thank everyone that's been able to join us from outside of the organisation. Very grateful to you for giving up your time and joining us for our annual public meeting. And I'd also like to offer my thanks to everyone that's presented this morning and contributed in any way to the management and delivery of this meeting. I hope that, as I said at the beginning, I hope that next year we'll be able to do this in person rather than virtually, but we shall have to see what we shall see. It just remains for me then to say that that the meeting is now closed. Thank you very much, everybody, for your time.